Good afternoon. Welcome to our session on Briggie, the use of artificial intelligence to improve patient safety and experience. And hopefully that you guys attended our demo in the morning and saw how we used artificial intelligence enabled nursing assistant to help with patient care, specifically with hourly nursing rounds. So why are we doing this in the first place? So what's the problem? I think we initially, actually, the project originated from us trying to assess pain in older adults. Now, myself and Diane, we work together on so-called frailty pathway, and we work with older adults that come to us after falls with significant trauma, and pain assessment was extremely important. And because we saw that sometimes when we try to assess the pain, it doesn't happen in time. There's things happen in the hospital. Nurses can get busy. There could be codes, transfers, etc. And we were thinking about ways to automate this process. But the more we looked into trying to use voice technology to do that, then we came across this hourly nursing rounds in the literature, and we said, oh my God, this is what needs to happen. It's not just a pain assessment, but it should be more broad. And so from then on, we thought about concentrating not just on the pain assessment, but actually on the whole patient experience. So if you advance the slide. Next slide, please. Okay. So this is a quote from Barrow Institute, and it says, what is patient experience? There's a sum of all interactions shaped by organization's culture that influence patient perception across the continuum of entire care. And patient experience is important. They by the Barrow Institute in 2018, they did a large survey across many hospitals, and they found out from the survey that patient thinks that overall patient experience is extremely important. 6 out of 10, about 59%, or 3 out of 10 patients said that it is very important. Next slide. And then this is a quote from Agency for Healthcare Research and Quality, that we consider that patient experience to be an essential part of healthcare quality. And so when they dug a little bit deeper, the patient experience is multifaceted word. You have patient progression, you have the services in the hospital, but what people were saying that most important for them in the experience was interaction with people. Okay, and within that, don't advance yet. But within that, it was the top 3 things that that patients mentioned in their interaction with hospital personnel was when they listen to you, that they communicate clearly in a way you can understand, and that treat you with courtesy and respect. And when if you want to summarize patient experience, when you have this beautiful graph, when different patients express their understanding of patient experience, the number 1 word that comes out is caring. Okay, so in the word of one of the greatest physicians in Harvard Medical School, Peabody, Dr. Peabody, the secret of caring for the patient is caring for the patient. So caring is central to everything that we do in the hospital. And the people, the frontline staff that takes care of the patient, they're the first to interact, and they're literally their face of the hospital. And then I'm talking about our nurses and patient care assistants. And that was very important because that is the first perception that patients get from the hospital is the interaction with frontline staff. And next slide. Okay, and so I want to ask Diane talk a little bit about patient experience and how important this is in overall picture of healthcare.
Mm-hmm. Yeah. Thank you, Dr. So patients tend to correlate satisfaction and quality of care with the nurse staff availability, visibility, and proficiency to meet their needs in a timely and efficient manner. Specific nursing measures of patient satisfaction factors assessed by our HCAP scores are how quickly call lights are answered, communication quality and quantity, and how well the patient's pain is managed. In 2007, in a response to the need for hospitals to improve their HCAPs, patient satisfaction scores, the Studer Group, a hospital consulting firm, developed the concept of hourly rounding and rounding with a purpose, which was implemented in several hospitals across the country and worldwide. Instead of randomly responding to call lights that cause disruptions and interruptions in care, the nursing staff would systematically round on all patients, decreasing the need for the patients to use their call light for non-emergency situations. The thought was that effective hourly rounding would relieve patients' uncertainty and anxiety that is often associated with vulnerable patient experience. I think that it's one of the things when we do read our HCAP scores and what patients do reflect upon, it's that basic need. And it's that basic need of knowing that they're protected and that they're in a safe place. And they're so vulnerable and they're reliant on our patient care assistants and our nurses to respond to them in a timely manner. So the Studer Group hourly rounding model chose to address 4 areas correlated with the HCAPs.
If you could advance slide.
Yeah. Perception of being satisfied with care. And these are referred to as the 4 Ps. Pain assessment and management, body or assistance with toileting, positioning for comfort and reduction of pressure ulcers, and personal items within reach or presence and personal attention. Next slide. Many studies on hourly rounding have demonstrated improvements in patient safety and quality of care. In addition to improved patient satisfaction scores, other corresponding findings include a significant decrease in patient falls and decreased hospital-acquired pressure ulcers. So hourly rounding also decreased call light volume and improved nursing staff satisfaction with their work environment. However, the implementation of hourly rounding has not always proven successful, and in some cases, the rounds have been found to be ineffective. Observations by researchers in some hospitals that have implemented hourly rounding have given the indication that these newer reports of negative findings may be more common as more hospitals are implementing the practice. There also seems to be a disparity between the nurse manager's perception of hourly rounding and what the frontline staff is actually doing. Some of the nurse leaders in the study sites felt as though the staff were performing hourly rounding consistently in according to evidence-based practice, but the researchers observed staff randomly going in and out of patient rooms, not purposefully addressing the required patient needs. I think to elaborate a little bit more on that is especially nurses and patient care assistants are going into patient rooms quite frequently. We do know historically that safety rounds do work. And then when we bring Briggie into it is looking at being able to satisfy that patient's need. Because many times the nurse who may have just given pain medication to somebody is now admitting a patient from the emergency room. And another nurse is admitting a patient from the ICU. And then there could be a patient who needs to be turned. So especially to increase throughput throughout the hospital, it's good to have Briggie brings us back to answering the need of the patient.
Next slide, please. So let me ask Diane. I know that there's a lot of research that have been published about hourly nursing rounding with very good results. Right, on the paper it looks really great, right? But when it comes to implementation, again, literature identified a lot of barriers, and in practice that was very difficult to implement. In your experience, and we talked about it before, like people try to implement there at I think at MGH, right, at Brigham. Why do you think that didn't happen?
We tried multiple different scenarios on how to implement nurse-patient safety rounds and incorporating our patient care assistants. But again, I think the difficulty in this is, especially being on a very busy unit, the throughput is always moving. They're constantly moving. And when the nurse or the PCA is busy, they're in a room, then that's, I think, where some of the deficit comes from. You know, it's, okay, was somebody just in that room?
Right. And obviously, you know, as you mentioned, nurses multitask, right? They're extremely busy, and at the same time, they get multiple call lights. You know, there's a lot of, you know, the cartoons humor about, you know, when patient not getting, you know, their services in time, etc. And then this slide is special that, you know, on average, nursing unit can receive up to 7,000 patient initiated call per month. I mean, this is a tremendous number on top of the fact that, you know, you have to enter things into Epic, right, and document everything carefully, because that's, you know, what do you think percentage of that time occupies?
Oh, it probably occupies, I would assume, at least a good, you know, 40%
Yeah. So, you know, the stuff that really comes down to patient care somehow gets lost, right? In all this technology, whereas technology really should be invisible, right? But now it's not happening. And so this is one of our patients that, you know, I took the next slide, please. Yeah, so I took this picture at the bedside, and you can see there's a remote control that is hanging by the side, and this patient was elderly lady, and she couldn't find it because, you know, frequently that would happen in the hospital, and the patient can all call the nurse, and they try to get up and they fall because it's very, very elderly patients unfriendly, right? Unfriendly technology. Next slide. And so what our nurses did, and this is very interesting, they started putting this sticky electrode, okay? So at least if they cannot find the right button, they don't have their glasses, at least they can feel with their finger that this is how we're gonna call the nurse. Next slide. And I don't know whether if you could play this video, that would be good. If not, we've been having some technical difficulties earlier. Let's try that. Okay, we're still having technical difficulties, but basically this is this was complaint from a patient that says that this is very difficult remote control for her to use. She's saying that it is very heavy. I mean, you know, she's frail. It's very heavy for her. It's hard to find the right button. It's hard to push the button, and she, interestingly, that's that, you know, she called it very poor apparatus and very clumsy. She used the word clumsy apparatus. So we don't want to give our patients clumsy apparatuses, because I mean that really poses a risk for patient health, and also takes away from patients' overall experience. And next slide, please. And next slide. Okay, and so this is a cartoon that I found. You know, I have to use this call button. I'm too old to learn new technology. Why can't I just scream when I need you? So this cartoon actually speaks about something very profound, right? It's funny, but profound in a way that the character is telling us that he wants to communicate by using his natural voice. You know, he wants to scream, obviously, but that's different matter. Patients want to communicate with the natural, with what we were born with. Okay, that's the best communication device that we have is our mouth. Okay, and up to this point, it was very difficult to do in terms of technology, and now this technology is advancing very rapidly, and we're all familiar with things like Alexa and Siri and Cortana, and voice technology is rapidly advancing across the healthcare world. And I want to give the floor to Steve Penny. Steve is our and Mass General and Brigham voice specialist who has extensive experience in voice design.
Thank you very much. Samir and Dan just laid out what I think is a really great foundation of a need, a patient need from both a experience perspective and a safety perspective. So, now that we have that sort of identified, what are ways that we can provide a solution? And with the, as Samir just said, the explosion of this voice assistance technology and the ability for really accurate and advanced natural language processing, it seemed like a really great marriage of solution, a problem and solution, to look at a voice user interface. So when we got together and started to discuss how could this work, a lot of thought was into really the patient experience and what is going to be effective for the patient. And as you can see with Briggie, the use of a teddy bear, where we what type of hardware it's been outfitted, how the user is going to interact, has been just a real big engineering and thought provoking series of sessions. Obviously, this looks a lot different than the first, as you can see, the smokestack Alexa that was maybe generation 1 or generation 2. But one thing that is really, 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 again, critical to this type of solution is user acceptance. And that user acceptance is really going to be found on their interaction, their voice user interface, and their consumer user interaction. I don't, obviously no one's here to raise their hands, but I want you to imagine or think back. How many times have you or someone you know maybe told your smart assistant to quiet, or that's enough, or cancel, because of the interaction? It was too long, or wasn't the way you wanted it. So in order to really try to create the best user interface, we learned from what patients are asking and what we've learned through studies and through our own experiences, what makes an effective voice user interface. With that, you have to look at the top interactions that people are having with their smart speakers. Weather, timer, and music. Very short, very rewarding and valuable interactions where they have immediate results. So as we design our user interface, we look at the way that we can have Briggie interact with a patient that shows compassion and understanding in a consumable time frame, but also not trying to sound too robotic and not trying to sound too like we're trying to mimic a human interaction. And with that base user interface, that base voice user design, we're then able to build using that as a foundation to be able to have maybe more intelligent conversations with the patient, drawing on previous answers that they've given for certain questions to shorten or even value add to the conversation. So you can see Briggie starts off with a core set of functionality that gives the patient a very powerful and very rewarding experience that we can then build upon, really make for a powerful solution to this very important and very right now problem that occurs in the hospital.
So thank you, Leslie. I have to apologize to our listeners who log in remotely, because we've been having a little bit of technical difficulties with video in the beginning, and what I forgot to do is to actually introduce us. Hopefully, yes.
Well, hopefully you're watching the demo.
Yeah, hopefully you watched the demo, which is called Hey Briggie, and so I just want to again introduce Steve Penny, who has more than 20 years of experience in working in IT, and then 10 years of experience as a voice technology specialist at Mass General Brigham, and Diane Sitters, who has been frontline nurse in ICU for many years, and then she has been nursing manager at A&D and C&D trauma, general trauma, and then ICU trauma for many years. And I'm Samir Turbayev. I'm a geriatrician who and I do trauma management, and then we got together, and then we've been working on this project for the last year and a half. So again, my apology. Let me, if you could advance slide more, one more slide. Okay, yes. So if you saw our previous interaction with Briggie, so this is what we call embodied conversational user interface, and this is very important. Embodiment is very important, especially for older adults, with cognitive impairments, because they actually find there have been studies that older adults find comfort in the soft toys like that. And in one study where there was a robotic puppy seal that actually allowed researchers to decrease antipsychotic use in patients with dementia behavioral disturbances. So, based on that, we thought that instead of putting voice user interface, which is disembodied like Alexa or Siri, we really want voice emanating from, cuddly physical objects, so to speak, right? And so, next slide. Okay, and so this is a basic infographic for how Briggie works. There's some hardware components that includes the brain of the Briggie, which is actually located in the torso, and it's a Raspberry Pi microcomputer. There's a portable battery and all buttons and the patient's ears, right? So it's very cute. And it can be connected to pretty much any voice AI platform via Wi-Fi. And then next slide. Okay. And so the Briggie patient interaction, again, I would encourage listeners who watching this session to go back, because our session, our early demo will be available online, and you can actually see the interaction for yourself. The important thing that unlike current voice assistants like Siri or Alexa, Briggie does not listen to conversations while inactive. And we feel that this is very important because it preserves patient privacy, it complies with HIPAA rules, and makes people feel more comfortable with that. Briggie wakes up every hour, and it will initiate dialogue based on 4 Ps that Diane just discussed a moment ago. And then you'll see that the nose LED light will indicate that Briggie is in active mode, so they know that if light is off, the Briggie is not listening. And then if patient needs something else in between, they can activate Briggie by squeezing, again, one of its ears. And the next slide. Okay. And so, 4 Ps, which we just discussed, so Briggie will ask patients about their pain, and so it will actually go in cycle, right? So it will be pain, then potty, personal positioning, and personal comfort related to whether they need something to drink or not. Okay, and so we believe that Briggie, the project that we're doing, will significantly augment current nursing care by conducting this hourly safety rounds. That is generally a good idea, but it's not being implemented because multiple barriers. And this functionality further will be enhanced, and then we were already thinking about food ordering, for instance, and patient education, and also providing bilingual control, right, or rather multilingual control. And this is what we think in the medium to long term. And then we feel that implementation of this project will significantly enhance patient experience, patient safety by reducing number of falls, by reducing pressure ulcers, and also from nursing point of view, our team presented the Briggie to Nursing Research Council, I think a year ago, right? And that was in very early stages, and people got very excited, and it's like, we want this on our floor, right? And then we also presented it to our Nursing Practice Council and AANB, and people are very enthusiastic and ready to start implementing this project. I think patients will like this as well. So I think our time is up, right? And the only thing I wanted, next slide. I was showing this to my son last night, and I was very excited, describing technology, and he actually, the 8 years old boy summarized it with just one word. They said, "Dad, it just makes the patient feel better." And I think that's, from a voice of the child, it's very good succinct summary, right? Briggie will make the patient feel better, and we'll end with that.
I think we have a networking session.
Yeah, I think we have networking section after this. So thank you for joining us today, and we'll hope to see you again.
Thank you,
Thank you,
everyone.
everybody.
Have a good day.